You know that one thing that you're really good at, that you're like super passionate about and you always seem to just kill it at? Well, nothing is ever perfect, right? So there's always going to be something that makes you mad about that thing. So today I'm going to talk about the common things that make people mad about medical coding. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I would highly encourage you to subscribe, hit that notification bell so that you can get alerts when I post new episodes. Now, one thing that will definitely not make you mad about medical coding is today's sponsor, which is Code. Code provides a really awesome platform for medical coders to take advantage of all of their experience and work when and how much they want. If you're looking to have more control over your coding career, you want to supplement your income, or even be your own boss, you should definitely sign up for Code. It is super easy. You just sign up, submit your information, and pass an assessment. So definitely check out codehealth.com, that's code with a K, today. So I really thought about the things that are frustrating, that make me angry, that I wish I could just snap my fingers and change about medical coding, and I narrowed it down to about 6 different things. Now, first and foremost, and I think a lot more people are mad about this than I personally am. So some of these are going to be things that I'm mad about. Some of them are things that people just in general complain a lot about. They wish they could change this about the industry. And the first thing is the cost. Becoming a medical coder is not cheap. You have to pay for your education, your training, your certification, your exams, and you have to pay membership dues. So every single year you have to pay membership dues to a HEMA or the AAPC. Currently, we're filming this in 2022, the AAPC membership is $190 a year. And you have to have a CPT book and an ICD-10-CM book and a HCPCS book. A lot of employers will cover that, although they'll give you software that you can use equivalent of those books, but not everyone does, and you sometimes have to pay for those books, or they won't pay for a certain specialty book or a resource that you want. And some of those resources, like our coding clinics, like our CPT assistant, they can be pretty expensive subscriptions to pay for. And if you're someone who's working solo, maybe you want to own your own small business doing medical billing and coding, you have to pay for all of those yourself. And then just when you're like, I'm done, I'm not doing anything else, you get this email and they're like, we're having a big training sale on this certification, you know, buy one, get one free, or buy it and get all the textbooks and exam for free, and you start getting FOMO. The FOMO, that fear of missing out because you've got this shiny new credential dangled in front of you, or this cool training that you really want to take, and you're like, oh, this looks so awesome, and I think this is the next thing I want to do to elevate myself. And you start spending money on training and certifications, and yeah, it all adds up. Now, is it worth it? I think 110%. Yes, everything that I have invested in myself has absolutely been worth it. But for some people, they might see that otherwise. The next thing that makes people very mad about medical coding is the gray guidelines. It is not black and white. It's not like doing algebra where you are all going to come out with the exact same answer. It is sort of this art and science to some aspects of medical coding. And some of the guidelines that we have out there are buried in like the Federal Register regulations from 2002. Or they could be in one of those very expensive CPT assistant articles. And you will find some employers that are not the best about medical coder research time, when you have to look up things and find articles and dig into the Federal Register, and it takes time away from productivity. You know, I've found many organizations, they will have non-productive time that you can track, but some of them aren't as savvy. You will find organizations out there that are like, hey, you're certified, you're the certified medical coder, you should know everything about medical coding. And that's really hard. It's like saying, to know everything about medicine. It's always changing. There's always something new. And that's why even healthcare providers specialize in one specific area. And I think it's great for medical coders to do that as well. I am certainly not the first to say it, but the riches are in the niches. Now, this is probably the one that you will hear the most frustration about, and that's landing your very first coding job. You have to have a very good job search strategy. And if you need tips on that, I have a whole video about job search tactics that you can check out. Because if you go into this with a half-assed search, you're going to get half-assed results. And let's be honest, this is not exclusive to the medical coding industry. You hear this about tons and tons and tons of industries. While there are some out there where you'll get a job right away, like if you're going into nursing where there's a huge need after you pass your nursing certification, right? But in medical coding and a lot of other industries, you know, it can still be tough to find that very first position. Now, the next thing that will make you very, very mad about medical coding is, oh, those insurance denials. I have met some of the most passionate patient advocates in the billing department. I'm telling you, like when they see a denial on a patient's claim where they have like a high dollar amount that they're going to owe because the insurance company doesn't want to pay it, I have seen them get pissed and they go after that insurance company. They'll get them on the phone. They'll get their supervisor on the phone. They will get the doctor to get on the phone with them, whatever it takes so that that patient is not responsible for that medical bill and the insurance covers it. They will go at it from every angle that they freaking can to appeal that decision and not have that go to the patient responsibility. Nobody likes getting medical bills, especially when you have insurance that should be covering it. And the cost of healthcare in America is freaking ridiculous, and that will make anyone mad. And it sucks as a medical coder, like we don't have control over it. We're just taking the information and converting it into the data that we need, not just for billing, but for statistical purposes as well. And when you get those denials for those patients who are like, this is definitely medically necessary, why are you not covering this? Oh, it's frustrating. And of course, the next thing that makes people mad and frustrated about medical coding is the constant changes. Of course, it's a thing that I've talked about in my video that I love about medical coding, that there's always something new to learn, but sometimes those changes, when they happen rapid fire, or it's just not at a good time, they can get so frustrating. Our diagnosis codes change October 1st of every year. Our CPT codes change January 1st of every year, and that can be another expense if you can't find cheap training on all of those updates, which is why you should be part of your community and your local chapter so that they can give you that information. A lot of them do. You know, it's hard to keep up with things constantly changing. So it's not just the codes themselves, it's the insurance guidelines, it's the regulations, it's even things like scope of different practitioners, it's even things like who is allowed to bill for what. And it never fails in medical coding. As soon as you get comfortable and you're like, yep, I've mastered this, I am doing it completely right 100% of the time, there's always something that gets thrown in. So it can be so incredibly frustrating, but again, it's one of the things that you kind of learn to love about medical coding is that nothing is ever the same. There's always something to learn and develop with. And even if you're a master of your specialty, you never know when something's going to change in your organization and someone's going to retire or leave and they're going to go, hey, we know that you're the master of this specialty, but guess what? You're going to learn something new today. And my final thing that people get so frustrated with in medical coding is those productivity standards, the accuracy standards. And more so the fact that a lot of places prefer the productivity versus the accuracy. And I have a lot of people ask me like, hey, I'm interested in getting into medical coding, or I'm just starting to get into medical coding. Like, how much do I need to do? Like, how many charts per hour? And it really, like, I can't give a solid answer to that. It really, truly depends. It depends on how quickly you can access the information. Is your system really slow? Do you have to go into multiple different programs? What type of coding are you doing? Are you just doing diagnosis codes? Are you doing surgical coding? Is it really complicated surgical coding? So there's a lot of factors. Like I can tell you that E&M coding, you're probably like 15 charts an hour in most cases, somewhere around there. But I really can't. It depends so much on your organization, the structure, their expectations, whether they're taking away productive time or not from your total calculation. Like I really can't give you a number. There are some benchmarks out there, but they're not as detailed nitty-gritty as you think they would be. They're more so like in profi coding it's this, in outpatient coding it's this, in inpatient coding it's this. And again, are they subtracting time that you have to take a phone call, email a provider, research something, talk to a colleague, go into a meeting with your boss? And some coders work hand in hand with the billing team. They look at those coding denials and go, yeah, this was coded correctly. I don't know why it was denied for coding purposes. Now, despite those occasional feelings of complete and utter insanity, medical coding is still a really amazing career. It is a very interesting and probably the most flexible career that you can have in healthcare. And it is a career that is constantly changing. You've always got something new to learn. You've always got something else you can do or train on, so you'll never ever get bored. And there's always some new specialty to learn or new skill you can learn or change that you need to learn, which is why it's important for you to make sure that you subscribe to this channel so you can stay up to date on all of those updates. And by the way, if you want to watch the video on the things that I absolutely love the most about medical coding, you can check that out here. And definitely don't forget to check out Code Health so that you can work when and where you want as a medical coder. I will see you guys in the next video, and until then, just keep on coding on.